notice you're coughing, so I'm going to suction your lungs to get that mucus out. Can you bag for me?
Coughing is one way to determine that a patient on mechanical ventilation needs suctioning. Another way is by evaluating breath sounds. Crackles or rhonchi may be caused by secretions in the airway. Before and after suctioning, always perform hyperoxygenation with 100% oxygen for 3 breaths to help prevent complications. During suctioning, alarms may be silenced but must remain on.
This will make you cough.
Monitor the oxygen saturation and cardiac rhythm during the procedure. The suction catheter should be in the ET tube no longer than 10 seconds. The patient is given several ventilator breaths before suctioning is repeated. When suctioning through the ET tube, use sterile technique.
All right, I'm going to get the secretions out of your mouth now. Can you open your mouth for me?
Following ET suctioning, use the suction catheter to remove secretions from the oropharynx. If additional suctioning is needed through the ET tube, use a new sterile suction catheter. Patients on mechanical ventilation need meticulous oral care.
I'm going to do your mouth care now. You don't need to worry about the fluid because I'm going to use this sponge that's connected to suction.
If the patient is nasally intubated, the teeth can be brushed without any interference. Special toothbrushes that attach to the suction are available to help remove secretions. In some cases, your patient will also have a bite block to prevent biting on the ET tube.
Can you open your mouth for me? I'm going to put a little bit of lubricant on your lips.
Even if your patient doesn't have teeth, the mouth is lubricated and rinsed, and the lips are lubricated regularly.
Now that we're done with the mouth care, I thought what we might do is untape your tube and reposition it to the other side of your mouth. We do that every 24 hours, and now would be a good time since we've gotten the tape wet with the mouth care. Julie here is going to help me by holding the tube. All right.
If, like Mr. Kirkpatrick, your patient is orally intubated, you'll want to move the tube from one side to the other every 24 hours to prevent irritation and pressure injury. To do this, you'll have to retape the tube. As a safety measure, this requires 2 people.
Move the tube to the other side of your mouth. All right. Very good. All right. Thank you.